Right. Hello everyone. Good afternoon. My name is Dr. Shashi Kiran. I am a surgical gastroenterologist and bariatric surgeon working at Fortis Hospital, Banerghatta Road. So let us discuss about bariatric surgeries today. To start with, we have to understand what exactly is bariatric surgery. So we have to understand what exactly is bariatric surgery and what patients qualify to undergo a bariatric surgery. So to start with, we all know bariatric surgery is done for patients who have got obesity. So let us understand what exactly obesity is. Obesity is a medical condition wherein the excessive fat accumulation in the patient causes an increase in the body weight, and because of which patients will have so many comorbidities. So whatever might be the problem with the patient, the comorbidities, it's because directly related to the increased weight gain in the patients. So to help them, we have so many modalities. To initially, we start with nutritional therapy. So if that's not working, then we have pharmacological therapy. If that is also not working, then we move on to what are known as pediatric surgeries. So whenever we say a patient is overweight, so we have to quantify, right? So not all patients would be considered as obese patients. So what do? We have what is known as body mass index. So wherein we calculate and grade patients according to their weight. So it is classified as from 18 to 25. So that is considered normal. From 25 to 30, people are considered overweight. From 30 to 40 comes the obesity, this one, bracket, and beyond 40 it's called morbid obesity. So people of interest, people who develop some complications because of the overweight, are people with BMI more than 30. So then why is this bariatric surgery important, and what is the relevance of the bariatric surgery in the current scenario? Is because of the increased incidence of obesity in the Western population, also in the Indian population setup. So it's been estimated that the prevalence of obesity is approximately 5% in India, and in Western countries is approximately about 7% in India, and it's increasing. And a new entity has come up in a big way, that is childhood obesity, wherein small children, people in the teenage group, they are also considered to be having excessive fat and having what is known as obesity and morbid obesity. Then comes the risk factors. So why do some patients become obese? So that is the so. Am I audible? Yeah. So next comes the risk factors. So there are so many. It's a multifactorial entity. Any patient who is obese is not because of a single factor, but the single most important factor is the genetic factor and the lifestyle, behavioral patterns in the patients, and that too over a long duration of time. So people who are into junk food, people who take a lot of calories, and people who are not working out, who are not spending whatever calories they are taking in, other people who are predisposed to become obese. So it's always has been genetic versus environmental factors, and it's not a single factor, as I told you, it's multifactorial. Then comes, why is it important? Is it just for the cosmetic purpose that bariatric surgery is done? So what happens if a person is overweight or obese? So, associated, as we all would be knowing about, are the other comorbidities. So, most of the patients who have been obese from quite some time will be having either diabetes mellitus, hypertension, the risk of developing osteoarthritis, because our knee joints are not supposed to be carrying that much weight. So, the gradual erosion of the bone joints, of the bones happen and result in osteoarthritis. People will be having difficulty in sleeping, so what is known as obstructive sleep apnea syndromes. And over a long duration of time, people who have got obesity are also known to develop some gynecological malignancies, the polycystic ovary disease, infertility, stress incontinence. All these factors are directly related to a person being obese. How do we know that? So patients, whenever who are obese with all these comorbidities, when they undergo surgery or when they have a very strict lifestyle modifications and they're successful in getting down their weight, definitely see a resolution or a decreased requirement of medications. So whenever there is weight loss, the associated comorbidities also come down significantly. So that is the major advantage. Second comes the cosmesis. So most of the surgeries which we undertake is not directly for the cosmesis, it's for the resolution of the comorbid conditions which I mentioned above. For the reason, that's the main reason as to why we suggest patients to undergo bariatric surgery. Okay, then comes, so how do we manage a patient who is overweight? So we directly don't jump to a surgical management. So initially, it's always conservative management. So conservative management mainly being dietary and pharmacological therapy. So how do we do? What do we do with dietary modifications? So we have to be very careful, especially nowadays, wherein the availability of junk food is it's widely available. So basically, we have to be very careful about the kind of food we are having, and we should always make sure the amount of calories that we are taking in, we are burning that sufficient calories in a sufficient way. So, for example, the normal requirement is around 2,000 to 2,500 kilocalories. So, if you are spending that much amount of calories, fine. If you can spend 4,000 kilocalories, also you can take 4,000 kilocalories per day. But having said this, burning those calories is very difficult. So even for burning of 1 kg of fat, so 3,500 kilocalories worth of exercise needs to be done. And so that's a difficult task, but very much achievable. And especially this is helpful in patients who are in a bracket of BMI between 25 and 30. So when it's beyond 30, the difficulty in bringing down the weight of the patients is difficult just with dietary modifications, because they will be having knee joint pain. So it's very difficult for them to be doing walking or jogging. So in these patients, the most important mode of reduction in weight is mainly the dietary modification. So exercise becomes very difficult in these kind of patients. When BMI shoots up to more than 35, then the surgery factor pitches in, because we have seen, obviously there are always exceptions, but in general, when we talk about, so patients who have got a BMI of more than 35, it's very difficult for them to achieve weight reduction. So most of these patients will be in bracket of around 120 to 150 kgs. So they can, with a lot of workout exercises, dietary modifications, bring down that weight from 120 to maybe 100. But sustaining that weight is very difficult, because the genetic makeup will remain the same, and it's very difficult for the patients to be compliant about the diet. So sometimes they might end up having a lot of junk food, and that adds to the weight gain that the patients would be having. So there are two factors involved whenever a patient is overweight or obese. One is achieving a reduction in the weight and maintain that weight throughout life. So some people definitely achieve that weight reduction, but it's very difficult for them to be maintaining that weight reduction throughout their lives. So at some point of time, maybe in their late 30s, people achieve that weight reduction, but when they reach their 40s and 50s, doing exercise is difficult. And if there is no dietary check, then definitely these patients are bound to again develop that increased weight, because genetically some patients are predisposed to gain weight. So we'd have normally heard that some patients always say, some people who are very overweight, they would keep saying that I don't eat much, but I gain weight. And there are some people who don't gain weight, but they will be having a lot of food. So in these patients, the genetic makeup plays a very big role. So now we have patients with BMI of more than 35 and 40. So how do we do about, and how do we help them? So we have what are known as bariatric surgeries. This is the time when we introduce patients to what are known as bariatric surgeries. So what are these bariatric surgeries? So it's basically a surgical modality wherein we are achieving some kind of restriction on the food that patient can take. For example, patients normally, as we human beings, always tend to overeat what is expected of our body. So it's normally, as we speak, even if we take decent meals for 2 times a day, that's more than enough for the calorie requirement, the energy requirement, the protein requirement in us. So normally human beings tend to overeat. So the basic physiology behind this is we try to achieve an early satiety in the patients by doing these bariatric surgeries. So patients normally who used to take around 4 chapatis as breakfast, so they will feel that early satiety after taking just 2 chapatis. So that is the basic concept. This is the concept of restrictive surgery. There is one more concept known as malabsorptive concept surgery. So wherein we bypass some part of the intestine which is involved in the absorption process. So patient tends to have those 4 chapatis, but his body absorbs only 2 chapatis, because the amount of small intestine that is available for absorption has been decreased, has been bypassed by the surgical procedure. So these are the two major techniques we combine them, or we do them independently. So accordingly, this is how the bariatric surgery works, and each process has its pros and cons. So the simplest one is what is known as intragastric balloon placement. So this is a temporary solution and doesn't bring about any change in the physiology of the patient's body. So as in, we are not cutting up the patient, we are not bypassing any intestine. So in this procedure, what we do is we just place a balloon of capacity of around 500 to 600 cc inside the stomach. That's all. And normally balloon gets dissolved after 4 to 6 months and just passes off. There's no intervention required to take out the balloon also. So we place this balloon. So the logic is simple. So there is already a balloon inside your stomach. So already your stomach is half filled. So whenever you try to take more food, so whenever we are eating, why do we stop? We feel that fullness in the stomach and we stop taking food. So that is the main concept. So in here also there is a balloon inside the stomach. So the patients will have an early satiety. So instead of taking 4 chapatis, we'll take just 2 chapatis as a result. And if the patient is also actively working out, so there will be a calorie deficit. So patient is taking less, but he's spending more of calories. So the fat cells become energy cells, and the fat gets destroyed. So this is the basic concept of weight loss using intragastric balloon. So the next most common surgery, that is the bariatric surgery that is performed, is known as sleeve gastrectomy. So as the name itself suggests, we make a sleeve out of stomach. So stomach capacity is being reduced to around 60 to 70% of what it was before. So 60 to 70% of the stomach is actually cut off. So the remaining is around 20 to 30% of the stomach. So basically, we make a tube out of the stomach. So this is again a restrictive procedure. So patient will have an early satiety because around 60 to 70% of his stomach is not there. So the capacity of the stomach is reduced. So whenever he takes that food, he feels that early satiety, and the quantity of food that he is taking in comes down. And as I was already previously mentioning about it, the human beings tend to overeat. So normally that amount of food is not required. So these patients tend to have an adequate quantity of food and lead a normal, healthy life. It's not that there will be some complications because of this. Most of the patients who have had a long follow-up are doing very good. So next comes the one of the common malabsorptive procedure combined with restrictive procedure, that is called a mini gastric bypass, wherein part of the stomach is cut and also some part of the small intestine is also bypassed. So in basically in this there are two main important procedures. One is called the mini gastric bypass surgery, another one is called the Roux-en-Y gastric bypass surgery. So all these procedures which I have mentioned about the bariatric surgeries, so most of them, and most of them, not all of them, will be done by a laparoscopic procedure or a robotic procedure. So hardly does anyone do open surgeries in bariatric patients. So predominantly is laparoscopic and robotic, and recovery is very good. Most of the times we discharge patients on post-operative day 2 or 3, and they have to follow a certain dietary pattern, so which will be advised accordingly. And weight loss is very good with these kind of surgery. So initially after surgery, the weight loss is around 6 to 8 kgs in a month's duration, and after that steadily it reduces by around 4 kgs every month. So that is the standard weight loss that happens with these bariatric procedures. So more important than weight loss is the resolution of the comorbid conditions that happens with patients. So many patients who were on who were diabetics previously and who were on insulin also. So maybe their dose of the insulin comes down as the weight reduction happens, and sometimes patients have been cured of the diabetes. So who had borderline diabetes or patients who were on oral medications. So once they achieve significant weight loss, many patients were completely like kind of cured of diabetes, because patients who are obese, the fat cells, they are known to increase resistance to insulin. So once these fat cells become decreased in quantity because of the weight loss, patients tend to become non-diabetic also. So similar advantages have also been seen in the area of obstructive sleep apnea, patients who are diabetic, patients who are hypertensive, patients who have had cardiac disease. All these comorbidities tend to have very good resolution with bariatric surgery. On top of this, obviously, we have a cosmetic advantage also. Patients obviously look more better, and there is obviously there's a boost in the self-confidence, the resolution in patients who are depressed, the fertility rate also improves. So there's so many advantages of bariatric surgery. So the most important thing that we always have to remember is obesity is a disease in itself. So many patients always have this query, sir, I look absolutely normal. Why should I undergo a surgery? Why should I risk that surgery? Is the question they normally ask. So you always have to understand, if not now, definitely all the problems which I was citing about will happen at some point of time. You're near 30 years of age, probably because of that early age and all, people don't realize the impact that it would be having. So, for example, you're 30 years old, but you're around 150 kgs. So that constant weight on your knee joints is happening on everyday basis whenever you're walking, jogging, and all. So that constant erosion of the joint is happening. So if it's not at 30 years, definitely at 40 years, you'll come back with osteoarthritis because the damage is already done. So, and if you come at 40 years when the damage is already done for the bariatric surgery, so we cannot reverse the damage that's already happened. So whatever damage is happening, it's like a chronic disease. So now or maybe after 5 or 10 years, so maybe after 5 or 10 years, the ill effects of being overweight will definitely show. So it can be taken as both a preventive and a curative surgery. People who already have this comorbidity can undergo this surgery for the resolution of the comorbidities, and patients who don't have any comorbidity or obese can get this surgery done for the prevention of the complications that are already that can happen, and definitely some complications are bound to happen at the later ages. So this was about bariatric surgery, and if you guys have any doubt, please feel free to message me and I can answer your doubts. So the first question is side effects of bariatric surgery and diet after surgery to maintain a healthy body. So it's a very good question. So any surgery for that matter uh, might or not always have the side effect. So, as I was talking about, restrictive procedures like wherein we are restricting the size of the stomach. So these kind of procedures hardly have any complications as such. So, but the malabsorptive procedures I was talking about, so we are bypassing a part of the small intestine, right? So some part of the food is not digested or absorbed. So accordingly, sometimes the nutrients also, the deficiency might happen if the patient has not followed a regular diet that's been prescribed by the dietitian. Like patients who have undergone bariatric surgery should always concentrate on the diet and have to take the food which is high in nutritional coefficient. So that is the kind of food if they are taking, and if they're on a regular follow-up wherein all these measurements of the micronutrients and all are made, so the deficiencies normally do not happen. And if at all, if any deficiency is happening, then always that can be corrected with the supplements. So that is the thing. For example, I was already taking 4 chapatis along with all the food and all the substances. So it's been reduced to around 50%. So obviously the nutrition that was present in the food is reduced, right? So if you are supplementing the nutrition, or else if you are more conscious about the kind of food you are taking, and preferably if you are taking food which is rich in nutrition, iron, calcium, and all those substances, definitely the nutrition deficiencies will also not happen. And obviously, these patients will be on a regular follow up, and regular blood checkups are made for any nutritional deficiency. And even if there is any minor deficiency, it's automatically immediately corrected. And the diet after surgery to maintain a healthy body. So it's the same diet as I was telling you. We normally tend to overeat. So whenever you've undergone bariatric surgery, so the diet modification will be normal diet only, but you're more conscious of the kind of food you're having, and preferably a high protein and food which is rich in nutrients, minerals, iron, and calcium. So you should be more conscious of this kind of food. So the next question is, what is the problem in future if anyone got bariatric surgery done? So there'll be no problem as such. So the only complication, long-term complication that can happen with bariatric surgeries is these micronutrient deficiencies. That also happens only if the patient is not following a good food regimen. Some patients they undergo bariatric surgery and then they're lost to follow up, and they start taking the junk food and all, thinking that already undergone bariatric surgery, nothing is going to happen. It doesn't work that way. So after bariatric surgery, if you are into high nutritious, good food, which is well balanced, definitely no problem is expected after the bariatric surgery. So the next question is, will I be given eating guidelines to follow? Yes, so post surgery for at least 2 months. So we have a regular kind of a diet. Like for example, we have the kind of foods you have is divided into phases. In the first phase, you are into complete liquid food, and in the second phase, you start with juices and all. In the third phase, you start with the semi-solid diet, And in the fourth phase, we start in the normal diet, and then the normal diet regimen continues just as a normal diet which we all take. The next question is, how soon after surgery should I begin taking vitamins? So, as I told you already, so if after surgery, even if you're not taking the good nutritious food which you're supposed to, for first 6 months, nothing is going to happen because our body has all the requirement for at least 6 months. So after 6 months also, no deficiency is expected to happen if your food intake is good and it is of good nutritive value. However, sometimes people, especially in India, wherein we are not very much concerned about the kind of food we are having, if at all that happens, so maybe after 6 months, we do a routine checkup, and different bariatric procedures are supposedly, if at all, if good nutritious food is not taken, different bariatric procedures can have different nutrient deficiencies, and accordingly, we make blood measurements of these nutritions. And if at all, if there's any deficiency, we can always supplement. And this supplement is not for lifelong. So we replenish it, and then we educate the patients about the importance of a well balanced diet. And accordingly, if the patient follows it, nutrition supplement is not required. So the next question is, can I eat spicy or heavily seasoned food? Definitely, after surgery for the initial 2 to 3 months, no. After that, just like normal individuals, whatever food you feel like, but in balanced, adequate quantity, not in huge amounts. Next question is, are milk products a potential problem? No, not at all. It can be a problem for a normal person or for a person who's undergone bariatric surgery. In some people who have got lactose intolerance. Otherwise, bariatric surgery as such has no relevance to milk and milk-related products. Next question is, should I avoid snacks between the meals? So I guess it's a general question. It depends on the kind of meal you have been having. If you've had a heavy meal, then definitely no snacking. So snacking is one of the main reasons why people are becoming overweight or obese for that matter, because it's the extra calories that we are taking in. And most of the time, snacks or do not have much nutritive value. Most of them will be a high calorie one, adds to the weight problem. That's all. But again, having said this, if you have taken a light meal, definitely you can take a snack. That should not be an issue. How long should I? The next question is, how long will I have to go without solid food after surgery? Probably for a month duration. So after that, you can start your normal diet. So the next question is, what are the routine tests before the surgery? Yeah, so it's a good question. So first we have to find out as to why the patient is overweight. So many patients come to us saying that, so I was absolutely of normal weight and probably in this 2 3 years I've started gaining weight. So there are certain hormonal conditions which can be causing that overweight issue. So we always have an endocrinologist involved. It's a team of doctors that evaluate the patients who would be planning to be who are planning for the surgery. So first we rule out any hormonal condition that could be causing that weight loss. And if there's any according hormonal deficiency, first we treat the patients with that hormones and then see if the weight loss is persistent, and then only we advise bariatric surgery. So the other blood investigations will be routine blood investigations, which is ordered for any surgery, like a complete hemogram, the hemoglobin levels of the patients, and his kidney function test and liver function test. So one of the main organs that can get affected patients who have been overweight is the liver. So nowadays, condition called as non-alcoholic steatohepatitis. So the liver is getting fibrosed because of this obesity and diabetes. So that's one of the reasons, especially in Western countries, for liver failure. So it's coming up in a big way. In India, it is still alcohol, the main cause for liver failure. But again, having said this, the non-alcoholic steatohepatitis that leading to cirrhosis also come up in a big way. And one of the main reasons for this, diabetes and obesity. So we evaluate the liver via liver function test. We get an ultrasound abdomen to look for the liver status, and also we do an upper GI endoscopy to see whether there is any reflux, and then we evaluate the cardiac status of the patients, because patients with this condition are known to have a cardiac issues. And then we do pulmonary function tests also to rule out any pulmonary issues, because obstructive sleep apnea is very common in patients who are obese. So these are certain basic tests that are most of the times done in all the patients who undergo bariatric surgery. So next question is, what impact do my medical problems have on the decision of surgery, and how do the medical problems affect the risk? So it depends on the kind of medical problem you have been having. So most of the medical conditions which are related to the obesity as such definitely tend to improve with the weight loss. So it's directly correlated. It correlates with the weight loss that the patient would be achieving after the surgery. Bigger is the weight loss, better is the resolution in the comorbid condition. So according to the medical condition, for example, if it is diabetes, hypertension, the cardiac status, obstructive sleep apnea, infertility, polycystic ovary disease, stress incontinence, osteoarthritis, definitely all these conditions will improve after the bariatric surgery. So probably that's the end of the questions. So as I was stressing on this, first people have to realize being overweight, obesity is a disease in itself. It's a difficult lifestyle. And bariatric surgery is not the only option you have. Definitely, the first thing which everybody has to do is lifestyle modification and dietary modifications. So, in our center also, whenever a patient comes for the bariatric surgery, we don't directly jump onto the patient for the bariatric surgery. First, patient has to show to us that he is motivated enough to undergo the surgery and motivated enough to follow the kind of food habits. For example, we do the bariatric surgery. If the patient starts continuing having very high calorie diet in the liquid form, our surgery will not work. So patient should be motivated enough. So what we follow is patient should have a weight reduction of at least 5 kgs on dietary modifications before the surgery. Only then do we operate on those kind of patients. So first thing you have to realize is bariatric disease surgery is a disease in itself, and lot of comorbidities are associated with the obesity, and dietary modifications does not work in the patient, then bariatric surgery is a very safe procedure to be followed. That is one thing. And with the weight reduction, there will be definite resolution in the comorbid conditions of the patients. And if the patient's BMI is more than 40, we always expect these comorbidities to happen in the later stages of the disease. So, prophylactic, that is preventive bariatric surgery can be done in these patients also, and it's safe. So there's always that this one key. Why do you have to get the surgery done? One thing is resolution of comorbid conditions and the side effects associated with the pediatric surgery. It's very less. So yeah, so that should be the take home message that obesity is a disease in itself, and definitely there is cure for the disease.